Thank you for joining Disability in Wisconsin for the first in our webinar series, Mental Health at Work. We're thrilled to have you join us and have a discussion with two subject matter experts on this important topic. Thank you for taking the time to join us. Mental health is an integral aspect of employee well-being, productivity, and organizational success, yet it's often overlooked or stigmatized in the workplace. Today, we aim to change that by delving into the key components of crafting effective mental health strategies in the workplace and sharing valuable insights and best practices for implementation. Our speakers this morning from Disability in Wisconsin's charter member, Froedtert Healthcare, will explore various dimensions of mental health strategy development, offering practical advice and real-world examples, from fostering a culture of openness and support to implementing resources and programs. This discussion will cover essential elements of a successful mental health strategy. As we gather virtually from different organizations and different industries, we recognize the importance of coming together to address mental health challenges in the workplace. By sharing knowledge, experiences, and innovative solutions, we can collectively work towards creating healthier, more supportive work environments where all employees can thrive. Throughout our discussion, we encourage active participation and engagement from all attendees. Please, if you have questions, I will do my best as moderator to keep an eye on the chat and pass those questions along to our moderators. Your insights and perspectives are invaluable as we strive to develop actionable strategies that can make positive impact on the well-being of employees across various sectors. I would extend our sincere appreciation to both of our speakers for sharing their expertise and experiences with us. Your comments and contributions will undoubtedly enrich our conversation and inspire meaningful action in our respective member organizations. So without further ado, let's get started. Thank you again for joining us. Just a couple of housekeeping measures. I will mention that we are recording this webinar, and it will be made available to Disability in Wisconsin members on the members only section of our website. Also, I want to point out, if you do need closed captions, there is an option to turn on closed captions at the bottom of your screen on the Zoom webinar window. So with that being said, we'll go ahead and jump in here. So first, I would like to allow both of our speakers to introduce themselves. Dr. Pilarski, would you like to go first?
Sure. Thank you for having me here today. So I'm Alicia Pilarski. I'm an emergency medicine physician at Froedtert Medical College of Wisconsin. I've been with Froedtert and MCW for almost 14 years. I am the also inaugural Froedtert and MCW Chief Wellbeing Officer. I took that role on 1 year ago, this month actually. I've also been involved in helped to establish our Froedtert and MCW Supporting Our Staff, or SOS Peer Support Program, which we established in 2019. And I continue to be the medical director for that as well. And so otherwise, I'm really excited to be here today to partner with Kate in this great discussion. Thank you.
Thank you. Kate, would you like to introduce yourself?
Hi, good morning, everybody. Thank you, Saul, and thank you, Dr. Pilarski. It's a pleasure to serve with you today with this group as we enhance and enrich a very important conversation. I'm Kate Nitschke. I am in leadership with well-being and wellness for operations of Froedtert and the Medical College of Wisconsin. I've joined a little over a year ago as I've been watching what Froedtert Health has been doing over the last 25 years right in my backyard. It was time for me to join an initiative where well-being and wellness, which is no longer just thought of in the garage or the parking lot, it's in the house and it's on the strategic plan. And I'm here very intentional for our state and our surrounding communities to help transform the culture of well-being and how we do that in the workplace. I also serve on my free time as the Mental Wellness Society as senior advisor and partner. That's a global initiative as I study and watch the global trends, and I have a history of national healthcare in this space. It's an honor to be here with you today. And Saul, I will turn it back to you. Thank you.
Thank you both. So our first question, what are some main challenges organizations face when it comes to addressing mental health, and maybe what are some broad strategies that those challenges can be overcome? Dr. Pilarski, I'll direct that to you first.
Sounds good. Thank you. So I think, being in healthcare in general, right there, we've always had a really, the biggest challenge has probably been stigma. Our healthcare team members for a long time were, as we kind of think back to even the COVID days, healthcare heroes was, something that came up quite a bit, but really that we're all human, and that hero mentality can actually be potentially a negative connotation, just because that kind of hero-like quality, that you don't actually suffer, that you don't actually have challenges or mental health struggles, physical, mental, emotional. And for a long time, I think there we had the expectation that we didn't have, that if you had those types of emotional responses or mental health challenges, that you would be viewed as weaker, that you couldn't actually do the job of caring for other people. So I think in our organization, and we still see this everywhere, is stigma is still a big challenge for many organizations. The other part, I think, is really the ability to not only have resources available, but timely resource accessibility. So making sure that if someone is in a crisis or needs mental health support, that we have not only the resources available, but ability to get treatment or a healthcare team member into supportive resources in a very timely fashion. So I think that's still an issue statewide. I know we have, access issues in terms of mental health. And so I think that still becomes a barrier for our organization. Kate, any thoughts?
I think you're spot on, and I would agree with that. Stigma is a standout word there. And that being said, as a result, we have to look at our steps of readiness, specifically as organizations, as employer groups, as leadership, on a top-down approach. And so as we become more ready, sometimes we have to be ready because it's right in our face. And I think through a pandemic and post-COVID, it highlights some of those silver linings that we can extract in a positive, which is what can we do about it as an organization? Well, we can acknowledge that there's a stigma. We can start with acknowledging that, and then we can accept that there's a problem. We don't have to accept that it's a fault or a blame or a shame, but we do have to accept that it's happening. And it's not happening to us, to you, or to me, it's happening. And so I think if we acknowledge as an organization and as a not only just a community, it's in our families, it's a friend, it's a coworker, and it's in our communities, and it's in our state, and it's in our nation, and it's in our globe. And so I think, as we look at readiness, and what can our organizations do about it, once we can acknowledge and accept, we can then start to gain more knowledge, we can learn more about it, and we can put things into action. So I think that's a great discussion. Thanks for provoking it, Saul.
Absolutely. Just a reminder to everyone who's joining us this morning, as this discussion goes on, if you do have questions, please feel free to put those in the chat. I'm keeping a close eye on that, and I'll be sure to pass those along. Going off of the topic of stigma around mental health, Kate, you started to talk a little bit about ways to address that, and I'm wondering if we can go a little bit deeper, maybe more detailed. And so how can organizations create a culture of psychological safety that encourages employees to openly discuss mental health concerns without the fear of that stigma or fear of discrimination or negative consequences?
Yeah, great question. And what we can do about it is create pathways, right? We can have an open dialogue. And in order to do that, it starts with people. And every organization has leaders or a leader. And again, I'm going to mention that top-down approach. It's essential that leaders become advocates, and that we are about the whole person. And it's important that we talk about mental health and physical health. We all have both. And to reduce those stigmas. And in essence, to create that psychological safety, it's important that we bring forward inclusion and that sense of belonging, that people feel heard, that they feel seen, they have a sense of purpose, they're motivated to come to work. They were hired because they have strengths they can bring. And I think, recently in a discussion, somebody asked me, it was a pretty loaded question, and it ties into your question, Saul. It was, what's the number one problem in the world today? I'm like, oh, that's not an easy answer. But I thought about it, and my response was, we need to listen more. All of us, we need to listen more. And I think it's important to know that listening is an action. And so as we talk about psychological safety, again, a sense of belonging, inclusion, we have at Froedtert Health and the Medical College of Wisconsin, we have a lot of different trainings for all staff at every level. And one of those specific around diversity inclusion says that that is more than just sex and gender. And it speaks to psychological safety. It speaks to sense of belonging, and it speaks to if you see something that's not right, say something. And we have implemented a value-based approach to our organization. That's one example of how I would speak to psychological, social, and emotional support are the three things that go into mental health for us all at any given time on our continuum of this journey called mental, physical health, healthcare, is to make sure we feel listened to, seen, and heard. And I bet Dr. Pilarski has some powerful things on that one too.
Thanks, Kate. I couldn't agree more with your statements already. I think that one of the things that when I think about psychological safety too, it really is woven into the culture, and the culture is built not only from the people who are within it, but it really is influenced by the leader in that space. And I think, making sure that we not only prepare our leaders, so allowing for training and resources about how to create a psychologically safe environment, but to assist in doing that when they are, having a difficulty with creating an environment or a culture like that. So I think, to Kate's point, we do offer leadership training, and we really are working to strengthen some of that as well, because we see such a direct correlation with the leader creating that sense of psychological safety amongst their teams and how that impacts the culture. The other thing that I think is really important that and I think Kate mentioned this a little bit too, is really being willing to talk about these things. I think that for a long time that, again, that sense of vulnerability was really looked at as a weakness, but actually what we need to start doing is rewarding vulnerability, especially with our leaders. I think when we think about, when we emulate our leaders or our leaders are role modeling, those are the things that really we want to see, that our leaders also struggle too, that there's not necessarily some magic wand that happens when you show up in leadership and you're not exposed to these things again, whether they're yourself, family member, a friend, another colleague. These are things that are, pervasive throughout all of us. So I think that, having leaders willing to talk about their own sense of, their own struggles or other things that are going on really allows for that safe space for employees to feel that they can also speak up when they're struggling, so that we can help identify resources that are available to people. Because I think that's one of the biggest issues is often we don't know when someone's struggling. And so until someone comes forward, or even a colleague is maybe worried about someone else and can help to identify maybe a struggling employee, then that's the part where we want to make sure that we are all kind of having that awareness piece of things. And I think it starts with the leader and the culture that we're trying to establish for this.
We did have a question in the chat that pertains specifically to Froedtert Health, but I think can be applied to a variety of different organizations. So the question pertained to if you and your team have had any interaction with the Project Search Team, which is a program that supports individuals with disabilities in employment. But I think kind of extrapolating from that for everyone on for everyone who's joining us, whether they're a Project Search site or not, how can employers ensure or do their best to ensure that mental health initiatives or that the mental health support that they are offering is really reaching all areas of the enterprise, all areas of the organization, and that there's buy-in from different functional areas within an organization. Kate, that might be best to address to you first.
Yeah, I might look, Dr. Pilarski, if you have any insight on the Project Search Team specifically, but how are we addressing and how can we be sure that what we're addressing is the right way to address it? I think it's important one of the things we've done here in the last year at Froedtert is we've created and implemented a one-page mental health resource sheet. And it has three things that it speaks to. One is if you're in an imminent or immediate crisis, what do you do? Where do you go? Many know what 911 is, and you can, when in doubt, if you don't know what to do, you can call 911. 988 was implemented longer than I thought. I looked it up. It was either 2005 or 2008, but most people prior to the pandemic may never have heard of 988. Some might have, and even to this very day. So I think it's important to make sure that we have, and in this concept today, in this discussion, not concept, in this discussion, we are in Wisconsin, I believe the majority of us, and if not, I'll speak to that too. But it's important to know our local resources like NAMI, the National Alliance of Mental Illness. They are extremely forward of their prevention, their access, and information, and having a pledge that you can pledge to. It's just like if you're a good Samaritan and somebody goes down and they stop breathing, wouldn't you like to know what to do? So and I'll speak to that further down the line. So how do we help individuals overcome challenges? We have to educate ourselves and be able to know of the resources available to us. They are there. And so we have to find them. And if they're hard to find, I think it's up to us and it's our obligation to bring them forward and to know what they are. And so again, I would start with the National Alliance of Mental Institute. I would start with your workplace on, do you have a policy or protocol in place? Just like you might an AED. What do you do when somebody's in mental health crisis? Who do you go to? Where do you go? Who do you call? And to just look at process and protocol. And so that's something that I think would be very meaningful at the employer level. And I'm happy to partner with you on that. And at that, I'll turn it over to Dr. Pilarski for any additional thoughts you have.
Thanks, Kate. And, I'm going to apologize that I'm not familiar with Project Search, given I'm not in the kind of employer leadership in terms of hiring and how that works. But I might be able to speak a little bit, and also because I'm on a Medical College of Wisconsin employment platform. So that's another part that I'm not familiar with. So I apologize. But in terms of kind of, again, gaining access for all members of our Freighter and MCW and, healthcare team members and staff, I think that the piece of this that's really critical is, to Kate's point, is making sure that people have an easy understanding of what is available, what are the paths to getting help immediately, in a sense of crisis. So we've created some pathways for that for our care team members to kind of really figure out if someone is struggling, what do we do in terms of that. We've also helped to recently embed, especially if someone is having thoughts of suicide or is in an acute mental health crisis, that we've actually created a process in which any member of our care team can be brought to the emergency department in a very confidential manner, so that they're not sitting in the waiting room, potentially seeing other members of the care team who are, we work with. And then we partnered with the emergency medicine physicians and nurses to make sure that the care provided to those individuals is timely, so that we're, kind of expediting that. I think the other piece of this is recognizing that, we have to be willing to really make sure that we allow people to step away from their current work duties if they are in that mental crisis, and what is the plan in place so that people don't feel that they're, in our sense, right, we have people caring for people. So what does that look like when someone has to step away to access resources? Who's going to potentially be covering that individual to take care of our patients? And so making sure that the processes that we have in place to ensure that, I think, is really critical. So really allowing that time, that space for someone to access the resources. And then I think the other piece of this as an employer is to make sure that it's inclusive. It has to be part of the benefits, right? It has to be something that's not added on to, whatever it is. It's that we understand people are coming from so many different socioeconomic backgrounds, different parts of, our communities and so on, that may not have the resources to access mental health on their own. So as part of a benefit, I think that's really critical. And one example of that I can call out is we have our employee assistance program that is not only the traditional EAP, but we have an on-site EAP counselors available and therapists who are there to provide in-person, in real-time support to members of our care team throughout the entire enterprise. And I think this is so critical, and it's made such an impact to have that real-time resource available that they show up. They will leave their office and go directly to the clinic or go directly to the inpatient units and provide support to members of the care team that are actively needing that. And it's part of their benefit of being a Freighter employee. So I think that's really critical to really make sure that it's embedded in your benefits, that it is something that is accessible at all times as well.
Absolutely. And I'm glad you mentioned that, Dr. Pilarski, because I'll just make a quick plug. One of the future webinars in this series will focus on benefits and including mental health care as part of benefits. So we'll definitely be diving deeper on that topic as we go forward. I'm wondering, and I'll direct this to you first, Dr. Pilarski. What tools or methods can employers use to assess the mental health needs of their employees, and how can they prioritize areas for intervention?
Yeah, that's a great question. It's tricky, right? Because I think you're not necessarily screening individuals when they come in, but you just need to have that sense of awareness. And so what we've tried to do is, at least for our team members, is to build in the training that is maybe additional kind of resources to help really understand what are mental health related issues and things, and how to recognize those in people, and then provide the appropriate resources. So, for example, one of the things that we've been doing throughout our entire organization, 2 different trainings that have been happening pretty regularly. One is mental health first aid. It's a great resource, a great training opportunity for any member. Anyone can take the course. It's about an 8-hour course in one day, and really helps. I feel like every leader should go through this training. I think it's a really great way to understand and how to respond to someone with it who's actively having a mental health crisis. And the other thing that I would really recommend is going through some sort of suicide prevention training. So we've done QPR, which is question, persuade, refer training, to many of our care team throughout the organization, not just leaders, but anyone, right? And I think these types of kind of resources and workshops and things of that nature are really important, because you want to really empower not just the leaders, but other members of your staff, your employees, because that's the eyes and ears, right? They're going to be the ones that are going to be able to recognize when something is not right with a colleague or a friend, in the workplace, and then they can help kind of bring in leadership as needed as well.
Yeah.
So I really think that the goal of our organization is to continue to train and educate and provide the skills needed, because this is not always something that's intuitive. Sometimes people, depending on your background, right? If you went and you're a psychiatrist, of course you're going to learn all this stuff, but traditionally, I think all of us need to have a little bit of that training just to be to understand the process and how to provide the appropriate resources and what to say in the moment. I think that's a big critical thing for people they don't necessarily know, and then they tend to just not say anything. So this is what we're trying to empower our care team to do. Kate, any thoughts?
Yeah, I mean, I completely agree. And I would just share that the training is imminent. And in addition to, the question is regarding what tools can we use to apply? And I think the goal and the objective is to be efficient and more so to be effective on how we look at prevention, intervention. And so I think we can also do 2 additional things. One, we can look at outcomes. We as a organization have an engagement survey, and that helps us pull by the questions and a third party, how are our team members doing? This year alone, we had our 5th out of the last 5 years, we had our highest response and turnout for those, which is really tells me, number one, we have an engaged group of employees, and that's wonderful, because I think it does start with engagement. And then how can we empower, as Dr. Pilarski had said, and motivate folks to do the right thing, to learn more, to help us advance in our understanding, to help us advance in our crucial initiatives. And so outcomes are important to look at. And the second is, again, what are we doing for prevention? How can we get ahead of this so it doesn't become an intervention? And I think that's everybody's wish, dream, and goal. And when we know better, we can do better. And some of the tools we are putting into place, again, is that mental health crisis resource sheet, as getting that education out there. I did a leader Q&A with our organization 2 months ago, And a question came out of that as far as are you putting this on any intranet or can we put it on the TVs and the patient areas and lobbies? And I was like, why didn't I think of that? So we're going to stream for the general population. What is 911? What is 988? What is the difference? What is NAMI? And it's just meant to be a quick visual where you can start to see it. And if you can start to see it, you can start to maybe imagine it. And one day you might need to utilize it. Other things we're doing for our employer groups, workforce health area of Froedtert Health. We reach over 700 employer groups in southeastern Wisconsin with Theta Care, our North region, and our current South region. We are implementing tools in the sense of people delivering programs on advocacy for leaders and for employees, for both. I went and got trained on QPR, gatekeeper certification, and I'm a leader, and I think that I'm obligated without anybody telling me I need to do that. I think it's all of our duty. We have, local areas. You can Google QPR in your local area. If you don't already have it in your organization, I would start with yourself and say, how can I learn more about this? I'm hearing these things. Dr. Pilarski mentioned it. Kate mentioned it. I heard it at my church last week. Wherever you're seeing this, how do you start to get inquisitive about learning a little bit more about it? And so the tools we're putting in we have a 4-series program, for example, we are bringing to our employer groups called Fostering a Culture of Well-Being, where we're talking to leadership and we're talking to employees about burnout, about the terminology around mental health. Let's get that out of the gate, because it's important to understand the difference between mental health, mental condition, mental illness, and again, normalize the conversation, break down the stigma, increase prevention, increase awareness. We are really working for that purpose and the tools to apply them in a very useful way. So another great question, Saul.
Absolutely. And you mentioned a few things regarding specifically leaders, and I wanted to dive in a little bit deeper on that. What role do people leaders and managers play in promoting mental health in the workplace? And you mentioned some trainings that are available, QPR and suicide prevention training. But how can they be trained to effectively support their team members' mental health needs? I'll direct that to Kate first. Yeah.
Yeah, great question. And the short answer is we aren't doing enough, and we should all be doing more. That's the short answer. Some of the things that are important to look at from managers and leaders are what are we doing, and what can we be doing, what should we be doing. But this is, and what we are doing is we're talking about it, and that's I think where it starts. We're talking about something that's very important, and I think it's imminent, and it impacts us all directly or indirectly. And so managers and leaders, some of the things we're doing is we're bringing this into our organization. We have over 800 leaders in our organization, and we every other week do a leadership question and answer. And on top of other very important topics, it's about a 30-minute segment. We offer it 3 times throughout the week. So we hit different times. It's recorded. So you're sure to catch it. And it's very highly attended, because these are things, whether it's upcoming flu season or a mental health crisis or Violence Prevention Week. We're talking about important topics that it starts with leadership. So we can then, leaders and managers are disseminating that information. I was going to say down, but I'm going to say forward to team members. I do a weekly newsletter. We do a monthly all staff, and we do every other month a department all staff. And it's very consistent on the topics that are within our organization. The other thing is, another active thing we're doing is we're gaining more training. I'm asked to come in and speak more to leadership groups and to provide information and resources. And so those are actionable items. And if I don't know the answer, I'm going to go knock on Dr. Pilarski's door and HR business partner and our employee resolution team, our intranet. We have a lot of information we're pushing forward in the sense of advocacy. Ultimately, it's my desire that we're all ambassadors of overall health improvement for the whole person. Mental health is certainly a crucial part of that.
Thank you. Dr. Pilarski, I'm wondering if you can speak to how managers and people leaders can be effectively trained, and what role they play in promoting mental wellness and mental well-being.
Yeah, so I think just kind of piggyback back of what Kate was mentioning is that, we're doing a lot of things, but we still have a long way to go. I think that we're, uncovering a lot of different training opportunities and workshops where leaders can get together and have these discussions. I think one of the big pieces of this too is how we can hold our leaders accountable to, and to understand, not to say, not to use it in as like in a punitive way, but in a supportive way, that how do we assess if leaders are creating psychologically safe environments, and how do we know that they have the right tools or resources that they need in order to do that. And so one of the things we started doing at Medical College of Wisconsin, and we're starting to really start to roll out even further, is using the Mayo Leadership Index, which is a really great tool to kind of assess leadership in terms of their ability to provide psychologically safe environments. And I think some of that is, again, meant not to be as like a punitive thing, but to say, like, where are you in your team and how you're creating this culture, so that we can continue to support and empower our leaders to do so, right? So I think as we're starting to roll that out, I think it's really critical, because sometimes our leaders, they don't know that they're creating, inadvertently, a culture that is not one that's supportive for mental health or psychological safety. And so we really want to make sure that we provide that feedback in a very supportive way. And so I think that's the other piece of this too, is what are you doing in your organization to ensure? And I think all of us have different measures of our leaders in terms of effectiveness, and there's always outcome measures of, everyone has different metrics, right, that we're all following for different reasons. But these specific tools are actually looking at that leader development and the impact that they have for their employees. And so I think I would, really encourage others too, as we're developing that for our own leaders and our own organization, looking into that Mayo Leadership Index and seeing what kind of questions you can, embed into other leader evaluations that will really give you some kind of a sense of what's happening in the culture or in the environment that your employees are into. So that's another thought.
And just to clarify, did you mention the Mayo Leadership Index? I'm wondering if you could just share maybe a little bit about what that is for anybody that might not be familiar with it.
Sure. It was a tool that was validated at the Mayo Clinic, that really is looking at the assessment of a leader and their ability to create a psychologically safe environment, one that's created to be a supportive environment, fear for, to making sure that there's no fear for speaking up or having, a sense of vulnerability. So I think that there's some really great questions on there. I'm pretty sure there's papers written about it. It's out there in the Google world, if you will, to kind of look at the questions. But I do find it to be a really beneficial tool to use, or at least even aspects of it, to really make sure that we're assessing our leaders and how they're doing, and provide support to make sure that they're growing professionally as well.
Sure. Thank you very much. So Dr. Polarski, you mentioned at the beginning, the challenge of healthcare access, and not just physical access, geographic accessibility of mental health services, but also cultural access, and the kind of returning to the concept of stigmas. So how can organizations ensure that their mental health strategies and their efforts in addressing mental health are inclusive and accessible to all their employees, including those from diverse backgrounds or diverse experiences? Kate, I'll direct that to you first.
Thank you. I think, you talked about it earlier when we mentioned, you said tools, right? I'm going to kind of slide that right in here as well. I think really the answer to the question is it's important to meet people where they need to be met. So when it comes to diversity and inclusion, I happen to think that if I were to take out the word culture, what would be a synonym to me is integrity. It's doing the right thing, try to remove the emotion and the stigma, which is easier said than done, but try to see the person for the person. Listen to what is being said, listen to what you're hearing, and really focus on what the person is saying. And so I do think that we are doing things where we have certain technology innovations and strategies that we're looking to apply. We have on-site EAP, we have courses, classes, the Learning Center, self-guided knowledge people can gain, advocacy opportunities and business resource groups, and a lot of different things that we do have in place. But I want to decipher something that I think is important here too. Sometimes we can get information overload and we might be confused of what to do, who to go to, and it's important for us, I think, to be consistent. And so part of our opportunity and strategy as an employer group is to really get aligned. And once we do that and we're aligned, it's important to know all of the different diverse populations. For example, in healthcare, we have administration, oftentimes in a lot of meetings, and we have frontline, and we have external, and we have internal. So I have a slew of folks on my team that are out in the work communities, and they're not behind a computer. So I'm not going to send them an important message hoping they respond to my email. I'm gonna call them. I'm gonna know what works best for them. And so I think it's really important to be intuitive from the leadership and to really look at how are we meeting people where they need to be met. There are folks that prefer group settings, in person, telephone, text message. And so there's a lot of different means of ways we can communicate. And so I think it's important for us to know how can we meet people where they need to be met, which tools and which approach are we most effective in reaching people. And that I think is going to help speak to the integrity of our common purpose, which is promoting information to all folks on the same opportunity of the same information at the same time. And if we crack that code officially here today, I think we're going to, get some pretty good bonus stars on that one, because it's still a code that I think we all need to crack together.
Absolutely. Dr. Pilarski, do you have any thoughts on regarding mental health care accessibility, either, again, geographic accessibility or accessibility in any sense of the word?
Yeah, I will probably touch a little bit on the peer support program that we created, because I think that is the intermediate step between when someone is struggling, whether it's something that's not necessarily mental health related, but just an emotionally challenging situation or distressing event. And as you can imagine, in healthcare, we see a lot of clinically distressing events and situations with our patients and other things and other situations that arise. We've had a lot of violence in the workplace, unfortunately, and that's been on the rise nationally. So when we, in 2019, created our peer support program, it was really to help combat some of the access issues in the sense of creating a network of peers. So other individuals that you work side by side with in the clinical environment, or not even in the clinical environment. You don't have to be a physician or a nurse. We have several other members of the care team, some security personnel. We have some of our administrative leaders on the team as well, as recognized, individuals who volunteer to be kind of that identified safe person that you can go to and have an initial conversation with if you're having some sort of emotional distressing situation, or just need to talk to someone. And some of that is understanding and being okay with asking the questions, are you okay? Right. And I think bringing again back that word awareness is, if we can be just, eyes open all the time and considering that, certain circumstances may predispose people to now have an emotional response secondary to exposure of a really traumatic event or a really distressing, patient situation, and how to reach out proactively and check in on those individuals that might be involved. And so our peer support program really, and back to the inclusivity, it is not just meant for a clinical provider like a physician or a nurse or anyone. It is expanded to the entire healthcare team and at all clinical sites throughout our organization. And so I think that's the piece that we recognize, that everyone may have, a day-to-day situation or something that may arise that would warrant just someone checking in on them. And so at this point, I think we're and individuals who are part of our peer support team go through some online training, and then they have an in-person training session that we've now, I think we're at 650 peer supporters across our organization. We all have little badges that identify us in the environment to say, again, this is a safe person. This is someone who I can talk to if that's a situation. And then I think with our peer support team, the one thing that's so critical too is they can help to refer. and connect people with resources that are available within our organization when situations are, more than just emotional first aid is needed. So, and I think that link too is also helping to break down the stigma of saying that, come talk to me and I'm gonna walk with you to this resource and we're gonna do this together. And so really that peer support program, I think, has been something that, again, really is slowly is making that culture, that breaking down that stigma and creating that sense of what Kate had mentioned is we're all in this together. We all should have the integrity of doing the right thing and taking care of one another. And we have to do that. So that's kind of the goal of our peer support program.
There's a question specifically on that peer support team. What types of training? You mentioned that there's online training and then in-person training. What is there training for the peer support team, and how can employers or employees implement such a training?
Great question. And so we actually, when we first got started, we had a external individual from the University of Missouri come to us and train us on our, on peer support and how to provide really it's emotional first aid and kind of how to do that. And also bits of psychological safety as well, having that sense of awareness. Ours was much more specific for the healthcare team, just based on the nature of our environment and the types of support that we're providing more regularly. However, there are lots of trainer, and then we used it. It was a train the trainer type model. So after they trained us that first time of like 50 people, we've since kind of adapted the training and expanded it to our organization. So there's a lot of emotional first aid training out there. And I think depending on your environment, as you can imagine, right, different environments require maybe a different understanding of what are maybe some more stressful situations that you need to be considerate of your employees. So, I'm happy to, see what other availability is out there. And I don't know if Kate has any thoughts on some of it, but really the emotional first aid is kind of that first sense of training and some psychological first aid too.
Sure. Yeah, Kate, if anyone who's watching is interested in kind of pursuing a peer support model within their workplace, what guidance or advice would you have for them?
Yeah, I think, they're more than happy to reach out to me and Workforce Health to help support in employer groups because I think it's vital. I do think it's extremely important. I'm glad that you're asking that question. And I do see some in the chat about how could we support or implement this. And so that's something we can certainly provide more information to you. And I just want to add to that, in addition to our peer support, we do have within our organization over 200 well-being champions that advocate and advocate for. We do a monthly well-being highlight, and so we integrate from nutrition to a different challenge to what's going on in the clinic to access to the portal and just truly highlighting information around well-being. It's comprehensive. There's a multidisciplinary approach. And in addition to the peer support, those well-being champions are truly there to champion the support at any given time for any given person within our organization. So there's a lot of synergy and opportunities there in peer support and then in our champions. So good question.
Great. And I do want to pass along a question from Connie pertaining to a peer support program for a largely remote or geographically distributed workforce. Do you have any ideas or advice for employers who maybe don't have large teams in one physical location?
Yeah, I could probably comment on that a little bit. I know some groups have done kind of like virtual check-ins, and they kind of schedule those on a regular cadence to have maybe one or like if you have peer supports identified individuals who want to volunteer and be a part of that they schedule kind of almost like office hours in a sense, but like kind of virtually coming in, come to talk, come to check in, and schedule those regularly. And I've heard from others who kind of do this on a more regular basis that's always that slow go, right? Like initially people are like, no one's going to show up, no one's going to have a conversation. But that over time, it's really built up into like a great place to connect with your colleagues, have a conversation about situations. Sometimes it can be helpful too to, provide some questions just to kind of start with the group, like, how's your week going? Tell us about the most challenging thing you've had to encounter this week. Tell us about the best thing that you've encountered this week, or that, a success story that you have, to really kind of start the conversation. So I think if those are really like kind of scheduled, whether it's over a lunch hour or it's maybe, at the end of the day on a Thursday or Friday or something, the last hour of the work day, that some of those have been pretty successful, I've heard. So that's another option for remote. Kate, any thoughts?
Yeah, well, that's exactly what we do for and the Wellbeing Champion example I mentioned. I was going to say very similar to what you did, Dr. Pilarski, which is you can schedule a virtual. Again, I would just emphasize volunteer. You want to empower folks to want to be a part of this and to be consistent. We do quarterly, it's recorded. We do get out of the 200 folks I mentioned, we get over a 90% engagement rate, which to me is a great success metric of people want to be a part of this. And so volunteer, keep consistent, set a time, and look at the frequency. Some examples might need to be meeting more or less, but I do think it's important to be consistent, to have a volunteer. And I do think it's important to have somebody organize it, have a leader of the pack, so to speak, who can help make sure it's sticking to a timeline. We have an agenda. The last thing I will add to that, you might think it's interesting by me saying this, but what we try to do is remove the why questions. Why are we doing this? It's more of the what is the challenge we're trying to solve, and how are we going about it? So I encourage folks to really focus on the what and the how. What is the challenge here? What's the opportunity? And how are we going to go about it? Those two forms of questions for the team to work around, I think, would be important in setting up any kind of a peer support in relation to how we're bringing those nuggets of advocacy, support, and resources around us.
Great. We do have a question, and I think I'll direct this to you, Dr. Pilarski, because it does seem to be more treatment focused. In some instances, mental health issues are accompanied by some kind of substance abuse. Is that something that can be treated at the same time? And I guess as a follow on that might apply more directly to employers, how can there is quite a bit of kind of overlap between substance use and mental health issues. So what advice would you have for employers who might be dealing with some of those issues in the workplace?
Yeah, I mean, I think it's just important to call out that substance abuse is a medical disorder, right? It's a treatable medical condition that, again, really, I think the thing that both of the mental health related issues as well, too, both our conditions are medical diagnoses, and they both, I think a lot of times too, there's a lot of biased or stigma about people who are suffering from these types of medical conditions. And I think you're right. They do oftentimes go hand in hand, because if you have an undiagnosed or untreated mental health condition, often substances are a quick and easy way to help kind of, in short term, address the symptoms that someone's having, but it can all obviously exacerbate symptoms as well. And so I think it's important to recognize that things of the nature can be often treated simultaneously. Sometimes it's, and I'm going to refer back to what we said, a chicken and it, what came first, the chicken or the egg, earlier today in our conversation prior to this. That's another piece of it. Sometimes mental health disorders are underlying from substance abuse disorders, and really getting to the underlying treatment of the mental health disorder can actually help to alleviate the substance disorder as well. So really trying to uncover, and that is best handled by a mental health professional to help kind of uncover, to treat, to provide, an ongoing treatment plan. A lot of people who have suffered or who are going through undergoing treatment, this is a lifelong thing. This is not you're going in and getting treatment for 2 weeks to a month and then that's it. This is ongoing treatment, just like you take blood pressure medication for blood pressure for probably, once you get on it, for likely the rest of your life, or any other medication that is kind of treating an underlying, physical situation. The same thing goes here as well. And so I think it's important for employers to recognize that it is not a one and done situation, that often these things take time, and to allow for employees to receive that treatment. And I can share a really quick story of, there was a surgeon, a very well-known surgeon nationally, who was actually the president of one of the more prominent organizations for surgical subspecialties, and came out very vulnerably in a big audience of hundreds and hundreds of other surgeons, and came forth and shared that she had been dealing with depression, anxiety, and alcohol abuse disorder, and the amount of treatment that she had to go through, and all the kind of steps that she went through. And this is, I mean, I'm not like, this surgeon was really well renowned, and her presentation, her sharing her vulnerability to the rest of the audience, just really was the most powerful thing that we've ever seen in healthcare. And that really had highlighted again that even the most high functioning people can still have these underlying disorders. And that doesn't mean that they are not going to continue to contribute and be so critical to your workforce and to the productivity of and the community and everything else. But if they receive the appropriate treatment, they will continue to thrive, right? And so she is right now sharing her story nationally, and she is, going through treatment, and she talks about it all the time. And I think she is really like a captivating. I can send you later the video for anyone to watch it. It's a very powerful speech that she gave. So again, just highlights the fact that, this treatment is powerful and is worth it, and to really hang on to, those employees who need it, to really support them through that.
Thank you for sharing that. So the next question I'll direct to you, Kate. Many in our audience are employers and are either just starting to look at some of these issues, or maybe have established mental health initiatives within their workplaces. But are there any legal or regulatory considerations that employers should be aware of when developing or implementing mental health strategies within their organizations?
Yeah, that's certainly something to think through. And yes, the answer is yes. It's important to look at legal and compliance first and foremost, to make sure that when we're bringing and introducing a topic, no matter what it may be, that it is in scope of our practice of what we're trained for. So it's important that we know that we're speaking about something that's important, and then that we have the right trained, qualified administration of it. So I do think it's important to, for example, we have health coaches, we have registered dietitians, and if somebody's giving free advice or saying, "Oh, it sounds like you're depressed," that would be a really out of scope, something we wouldn't want to say. So what I'm saying is, we don't want to take on something that's not ours to take on. So it's important when we look at just the whole bandwidth of legal and compliance, that we are in scope of practice. And that's exactly why Dr. Pilarski answered the last question. She's completely qualified, trained, and experienced, and I'm more on that prevention and well-being side. So I would not have given that same answer. I would have went to my scope of well-being and prevention. And so that's why you have us both on your panel. So we can, because it's both, but it's all relevant. And so it's important to look at legal and compliance. Let me give an example of that. Prior to my employment here, I was working and developing throughout several states an orthopedic injury hotline. If a firefighter or police officer is injured on the job, who do they call and where do they go and what do they do? Well, we created a hotline, and we had qualified trainers to be able to receive those calls and to be able to set up the next step of member advocacy. And so again, it's important to, if you're implementing something, it's important to be thoughtful and careful about what goes with that. It's important to know that you're staying in scope, and certainly check out with your legal and compliance department. And if you don't have one, there are resources out there. Again, I'm going to reference to NAMI, the National Alliance of Mental Illness, for support and resources. It's free, it's available. I'm going to reference your own organization and what you've done, and the process and policies you build, and what you have and why you have them, and are they needed, or do you have guidelines? And then I think it's important to make sure you lean on your partnerships. So lean on the experts to bring in information, and that'll keep you in scope. And if you're not sure, it's important to try to find out who might be the next best appropriate person to help you establish that. So
sure. Thank you. With just a couple of minutes left, just a reminder, if anyone does have any last minute questions, please post those in the chat. I'll be sure to pass those along to our panelists. But the last question that I have prepared is regarding employee resource groups. Many of the organizations that we work with have established employee resource groups or business resource groups that, among other things, focus on mental health and mental wellness. So what role can these types of affinity groups play in supporting mental health initiatives and fostering a culture of inclusion and support within their organization? I'll pose that to Kate first.
Yeah, as you said, we do here at our organization have several business resource groups, and from women in leadership to military and vets to LGBTQ, we have Latinx, we have Black African American, and so it's important that we keep our business resource groups focused on all the opportunities that are relevant and really, again, I'm going to use the word advocacy, that we are bringing this forward. You know, I'm an advocate all day long to try to make sure we have our one-page mental resource, that it's developed, that we send it to the right people, that I learn and understand other areas that I might not yet know, and that I'm inquisitive and have a desire to learn more and to work to help be part of the alignment, to help all those resources align with the business resource groups, our well-being champions, our intranet, the TVs and our patient lobbies, and again, our leadership, our top-down leadership, and those leaders Q&A. So again, I'm gonna stay focused on how do we align all the great resources and pull off all the amazing strengths, so we are advocating, not confusing. And so those are really great opportunities for us to continue to stay well-rounded.
And we're coming right up on 11 o'clock, so I want to be respectful of everyone's time. We have a couple of questions if folks wanted to reach out, or Kate, if folks were interested in some of the services that you provide to employers, how can folks reach some of the resources that you have?
Well, I just spelled my name wrong in the chat, but you can email me and I'm going to retype Kate at Nitschke. I can never spell my own last name very 5 consonants in a row. It's just cruel. You can certainly email me, and certainly you could also reach out to Saul Newton, our moderator today, who is in touch with both Dr. Pilarski and I. Email is a great method to begin, and I see that Dr. Pilarski's left hers as well. So I welcome the discussion, and I welcome the opportunities to align together so we can continue to get the needle of prevention ahead of intervention.
Perfect. I will share the contact information to everyone in a message after this. So thank you all very much for joining us. I want to specifically thank Dr. Pilarski and Kate Nitschke from Froedtert Health in the support of Froedtert Health for Disability in Wisconsin. Appreciate both of you taking time this morning to share your expertise. Rafilwe, the recording will be available to Disability in Wisconsin members on our website. So within the next few days, I'll be sure to get that added. But we're one minute past now, so I will thank everyone and wish you all a very good rest of your day. Thanks so much.
Thanks for having us.
Take
Thank
care.
you. Bye-bye.